Tips for ensuring patient safety in healthcare settings. Patient safety is a healthcare discipline that aims to reduce risks and prevent harmful errors that may occur during provision of healthcare to the patient. Some of the principles that guide patient safety are minimizing physical, mental, or emotional harm, safeguarding all private patient information, designing protocol to prevent any accidents, neglect or misdiagnoses, and reporting issues as they arise. In a highly complex and stressful environments such as hospitals, human error may occur. Some of the patient safety issues include slip and fall accidents among patients, prescription or medications management errors, inappropriate use of personal protective equipment, poor communication leading to problems in care transition and discharge, and improper standards of sanitization leading to cross-infection. Here are some tips to ensure patient safety in healthcare settings. For effective communication, involve and encourage junior members, managers and employees to join in the decision-making processes. It is helpful to perform regular organizational performance reviews and adjust policies accordingly. Use up-to-date monitoring systems for the easy retrieval of patient information between nurses and doctors during different shifts. Ensure that patients have access to bed alarms, call bells and other patient safety measures. Making sure patients have a clear understanding of their condition and treatment is vital to patient safety and preventing errors. Educated patients and caregivers can ask the right questions and detect potential issues as they arise. There is a dearth of health-related information available on the internet. Patient education can help them understand what facts apply to their specific circumstance. One of the best strategies to ensure patient understanding is to simply ask patients to recall and restate what they've been told. A standardized verification process to prevent unwanted mishaps. For example, universal protocol devised by the Joint Commission recommends that members of the team take a timeout to verify details of patient's treatment. Every clinical action should be independently verified by all members of the patient's healthcare team during timeout. This includes surgical procedures, blood transfusion, medications, etc. One of the first steps in infection control in a healthcare setting is good hand hygiene. Always wear the necessary personal protection equipment when handling or interacting with a patient. Ensure that areas of the hospital frequented by patients are thoroughly disinfected at regular intervals. Care should be taken to label all of the patient drugs, pills, capsule, syringes, cups. Double-check if the right drug is being given to the right patient, using universal protocol and help from pharmacists. Ensure that a thorough history of patient medication is taken to avoid use of conflicting medications. Clearly note down any drug intolerances or allergies in the patient's chart. Hospital design must be patient-centered. Some of the features to be taken into account include air quality, ease of information access, noise dampening, decentralized nurse stations for better observation, convenient sanitation stations, and a distraction-free pharmacist workspace. Clear documentation can minimize mistakes that may arise from lack of communication between departments, doctors, nurses, and pharmacists. Create succinct and easy-to-follow discharge summary for the patient that includes medication schedule, follow-up appointments, and a list of names and contacts in case of any problems or queries. According to some estimates, this can help decrease potential readmissions by 30%.